Welcome to Frontline Nursing, a NurseMinder production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you are considering nursing as a profession, you are already a student, or you're a nurse looking to transition towards a new patient population, this show will give you some behind-the-scenes information to help guide your career. Today's episode is all about working as a float nurse on busy surgical units in a large city hospital that takes care of level 1 and 2 traumas. This nurse specialty focuses on providing direct patient care to adult patients pre and post surgery in both acute and chronic conditions. It is a fast-paced environment that will keep your feet hopping, so get those note apps and pens and papers ready because this is going to be a good one. Today on Frontline Nursing, we are joined by Jenny Rasmussen, an LPN who is nearing the end of her first year working on a busy surgical unit, and as a bedside nurse in one of the largest hospitals in her city. Graduated in 2017, you just recently transitioned to working on a busy surgical unit and coming up to your first year there. So I appreciate you coming on and sharing some of the struggles and successes a first-year nursing student goes through. Welcome to the show, Jenny.
Well, thank you for having me.
I'm delighted to have you, actually. So let's get started with just a question about how did you find nursing as the career choice for you?
So originally, I really didn't know what I wanted to do. I did retail.
Oh, we lost your picture for a minute. What's going on there, girl?
Like I said, renovations are happening in my house. And I think my husband's working on the electrical.
That is too funny. We'll go without your photo for now, I suppose.
Okay.
Oh, there you are! Yay!
All right. So I dabbled in retail, and I thought I really liked it, but I didn't in the end. I joined the police academy and got kicked out. It was not for me.
Although I'm sure that training comes in handy as a nurse.
It does. So at the end of the day, I just really looked at the things that interest me, and that was one-to-one interaction with people. And growing up, I was surrounded by nurses. I was in the hospital quite a bit, as well as a lot of family members. So we had a lot of home care. So I had in my head what a nurse does, and I thought I'd look into it.
Awesome. So it does sound like you had a lot of influence that may have been guiding you on that path, although you wanted to try the policing first. So that's rather interesting.
Yes, actually.
Ironically, I too was going to go into the police force when I was younger, and I was supposed to have my eyes surgically corrected to join, and I wasn't quite comfortable with the processes then, so I switched careers.
Good choice.
Yeah. Awesome. Now, it looks like it took you a while to get into the hospital since you graduated. What were some of the struggles you were finding in finding that first job?
So every student, their goal, I feel like, is hospital. That's the golden dream. Mm-hmm. I went on interviews and I was really nervous, and that got the better of me in interviews, and I didn't do so well. So I had one interview where a manager pulled me aside and she's like, I know you're struggling and like you're a new grad, I'll give you some pointers, and that made all the difference.
Wow, that's
so yeah, so she pulled me aside, she took a look at my resume, and which I got professionally made was completely wrong.
Oh no.
for the medical world, what they were looking for and just how to display everything. So after having that interview and her telling me you just need to have someone do questions with you back and forth to make you more calm in interviews really made the difference. But I think that was my biggest struggle, is getting through an interview. It just was not good.
How many interviews did you have before you were accepted into the surgery float pool? Do you remember?
I had about 6.
Mm-hmm.
But before I even had interviews, it was hard to get calls just because they're looking for someone that has connections in the hospital as well as experience in a hospital.
You know, and that's a good point to make. And so for those who are listening who are just coming out of school, they're going to see all those job ads that say, you know, minimum experience of 2 years. Do not let that stop you from applying. All that means is if there's a candidate with more experience in that unit, they will consider them above you. But make sure you're putting those resumes in.
Correct.
Is that the same advice that you heard from others?
Kinda, like talking to nurses that already got jobs. They said they got a referral, so that's where I thought I was making or not mistakes, but that's why I wasn't getting those calls, is because I had no connections in the hospital. But all it took was my connection in my preceptor and my clinical experience in the hospital that I was applying for a job. So I make sure in my cover letter, I really emphasize that I worked at the rural ALEC, and that seemed to make a difference.
Where was your last focus clinical? Was it in surgery?
So so I was at the Alex for all of my experience. So medicine, surgery was in the orthopedic surgery center.
Oh, that's a
and
fantastic
then
center.
Yes, we call it the Palace.
Yes.
And then my preceptor took place at the Lois Hole for postpartum.
Okay, and so your focused preceptorship didn't result in a job offer.
Kinda. They offered me a interview.
Okay.
And unfortunately,
interview. You know what? That's okay. For a lot of people going out there for the first time, this is a professional interview, and it's a lot different than retail, where most people are coming from when they're young and transition into their professional career. So those first few interviews are so critical just for learning and growth more so, and really difficult to land that first job right out of the hop.
Yeah.
So surgery then, is that just that's just the job you took because it was available, or were you interested in surgical patient population?
I was really interested in surgery. I would be thankful for any job offer from the hospital, but anytime I talked about the or nursing, it always referred back to my experience in surgery, in postpartum, and that's where I just felt the passion when talking about.
That's awesome that you got a job in an area that you're passionate about. So let's talk about how talk about your very first day when you were now done your mentoring, you were now first on your own with your own patient load, you weren't having that funny nurse anymore. What was that day like for you?
I cried. So
for joy or for like stress? Probably maybe a bit of both.
It was very scary. So in your preceptor, you're kind of on your own, but you're still backed up that you're just a student. If you do anything wrong, you have someone on your side and that can hold your hand if you need it.
Yeah.
When you get into the medical field and you're now not a student, you're an employee, it's like a whirlwind. It's terrifying. I remember even before my first day during orientation, I almost question if I'm cut out to be in the hospital, because what we learn in school doesn't really prepare us. I feel like we lack a lot of preparedness for the real world of nursing before we enter in. You get your 4 to 7 patient load, and you're all of a sudden expected to know everything and do everything and not have questions, which is sad, but it's still the nurses eat their young. It's still very much like that on the floors. So when you're a new person coming in, you have all these questions. It's really important to find someone on the floor that is willing to take you under their wing, because a lot of people won't. So if you find that one person, hang on to them and really dig in deep.
Being a float nurse and moving from unit to unit, when you started, were you primarily positioned on one unit so you could kind of get comfortable with that unit before they moved you?
Yeah, so that's the great thing about the float program is you start on one unit, and it's usually a unit you think that you'll be comfortable with. So they put me in orthopedics because that's where I had experience.
That is a heavy unit. I've done orthopedics. Oh,
yeah. I learned orthopedics is not for me.
Yeah.
But yeah. So you have 3 buddy shifts, which is not a lot.
No.
So you have evening, a night, and a day buddy shift. Mm-hmm. And unfortunately, buddy shifts, we're used to, as student nurses, shadowing someone that doesn't exist as a buddy shift. It's You take the full patient load, and your buddy's there to answer questions.
Yeah, and help out and rescue you and all those kind of things, yes.
Which is terrifying to begin with, because you're still stepping in fresh and you're dealing with patients that are your own. Sorry, I kind of lost my train of thought there.
Buddy shifts, you got 3 of them.
Yeah, and so you do the 3, and then you start working on the unit right away. And as soon as you're comfortable, you call your manager for the float pool and you say, I'm ready for my next unit. You can take a week, you can take a month, however long you need.
Okay, do they have kind of a maximum time that they'd like to keep you on a unit before they transition you over?
No.
No, that's really up to you to set the pace.
Yeah.
That sounds quite supportive in that sense, but it sounds like maybe the type of mentorship you had got paired up with wasn't always so conducive to feeling safe.
Yeah.
Mm-hmm. So after your orthopedics, talk to us a little bit about some of the other units you got to explore.
So I started in orthopedics, and I honestly thought orthopedics is where I wanted to be.
You know what, that's funny, because that was my first unit too, and I loved it because you see a lot of different things and you learn a lot of different skills.
Mm-hmm.
When you move to somewhere else, you go, hey, wait a second.
Yeah, it's like a whole new world.
Yeah.
So
So where did you go next?
So after that, they moved me to, it's still orthopedics, but hip and knee program, which is totally different too. Yeah. It's all rehab that does everything, which is nice.
And but I'm familiar with those programs. So you've got very prescriptive days, day 0, day 1, day 2, day 3,
oh, yes.
At the door sometimes, right? And they don't stay long. They're really quite efficient at those surgeries and the post-op care.
Yes. And then after that, I went to palliative care. And it really wasn't for me. And the nice thing is you can vocalize that to your manager and they'll support you because it takes a special nurse to be in palliative. So I no longer go there. It's just not for me. And then after that, I went to urology, which is by far one of my favorite units. I love it completely. After urology, I went to plastic surgery and bariatrics. Mm-hmm. And then after that, I went to gen surg. And now I'm in ophthalmology and as well as day surgery.
That's a really good rounded resume. Like, it sounds like a float nurse position would almost be an ideal position for a new nurse in the sense that you are exposed to so many things. You do get to experience so many skills. And so to me, that's one of the bonuses. Are there any other benefits to being a float nurse that you can share?
Kind of like what you said, every unit's so different. You learn so many new skills that you didn't think that was in your scope. And you just feel more confident. Like, I feel confident now a year in, but it took 6 months for me to feel comfortable to walk onto a unit. But it's really grown my confidence as a nurse because I can go on a unit and all units have off-service beds and they have a bariatric in ophthalmology, and the nursing staff on ophthalmology have no idea for certain things. And as a float, you can really step up and show what you can do, which is really nice.
Yeah, you really get to be a leader in some moments when you've got a patient. You know, you think on a surgical floor, and just for an example, you maybe have a mental health patient. Well, surgical nurses aren't mental health nurses, so they really struggle with the two mixed together.
Yes.
Now, you might find yourself on that ophthalmology and you have a bariatric patient at the same time, and you've kind of got that background on how best to work with them and some of the tools and the tricks of the trade that you've learned from the masters that you can bring to that bedside. That sounds great. Now, are there any, now I will say, I'll just go back to a few points that you had shared. One is that you didn't feel comfortable until 6 months. I just want to share with you and anybody else listening, the research shows it takes 2 years for a nurse to feel comfortable about her skill set on the same unit. All right, so as a float nurse, you are having to master those skills at a much accelerated pace and really kind of find your groove. Because every time you go somewhere, you don't know where things are, supplies, paperwork, processes, and you're having
to this day, you mix up units and you're like, where is this stuff? But
yeah, right. You're right. And you're in the dirty utility room. And you're like, no, that was the clean room on the other floor.
Yeah.
And the other thing I wanted to go back and just highlight was, what did you say? Oh, shoot. This part of getting to be older, I forget my train of thought sometimes. Oh, I did this with my interview the other day, too. If it comes back to me, I'll come back to that question. Let me go back to my questions here for you. Tell me some of the more interesting, I mean, we can't obviously reveal any confidential information. We know that.
Yeah.
But what were some of the more interesting things you've seen and got to participate in that really kind of lit your fire for a particular nursing area?
I would have to say my first Code Blue.
Oh, good. I'm so glad you got that.
I feel like that's really, it can happen at any time going into a hospital setting, but until you actually participate in your first Code Blue, I feel like your eyes widen. So every time you walk into a room, you really do notice the little things. And not that you don't take it serious, but you take it more seriously. When you see a patient 1 minute and 3 minutes later, they're not breathing, it's crazy how fast things can turn around in surgery.
Mm-hmm.
And
great. Mm-hmm.
that's honestly the rush from surgery really motivates me to learn more and do more.
Mm-hmm. Have you been in more than one Code Blue?
I have, but I've only actively, I ran the Code Blue until the code team came.
Wow.
Thank you, Tammy.
I'm impressed.
And being in charge, when we do our Code Blue sessions, it's chaotic. It's very shocking how calming it is when the proper leadership gets there.
Mm-hmm.
And sometimes you really need to yell at everyone be quiet, because everyone's trying to yell at each other. So it just makes you look at things differently and how to lead differently, and also when to lead. So if you have two people trying to lead, it's not going to happen. So maybe step back and let the other person lead is kind of what I learned. The other codes, I was just in the lineup for CPR, but wasn't needed. So yeah.
Okay, yeah. So I think that's fantastic. First of all, every time I take a student group out, and it has been probably consistent for the last year and a half, that every time we go to the unit, there has been a Code Blue, either on our orientation day or during our month on the unit. So they've all been exposed at different levels, and the comfort that comes with seeing the team. It does always feel chaotic on a unit. It doesn't even matter how many times it happens. It's just so startling, and there's so many components to move and maneuver while you're waiting for that team that it's chaotic and it's stressful. But you're right, when that team hones in on there, and I used to be part of the Code Blue team, so it was just, they're in control. They all have a role. They know what needs to be done. So there is really not a lot of dialogue about tasks. It's more just about listening and waiting for your cue to do what you need to do by the lead.
Yes, I would agree. Yeah. So never run away from a Code Blue. You're in good hands.
Get in there. Get some pumping action in there. At least that.
Yes.
Know the physicality and how much you have to work to actually.
Oh my goodness. I was in so much pain. I couldn't lift my arms up for 2 days. We went 40 minutes CPR with 3 people. It was crazy.
Wow, that is intense.
But you power through. You don't notice it, because not that it's a rush, but the rush during a code just moves through you. And
yeah, no, there really is an adrenaline rush. It's that fight or flight. You're like, you didn't fight, you stayed to fight. And so the same hormones going through your body. So just speaking of CPR, because that is actually one of the questions students ask a lot. So that was coming later, but I'm glad we're addressing it now. Have they all been successful, your codes that you've been involved in?
No, I've only had one successful one.
Yeah.
But so with the Rural Alex, we get a lot of inner city, and you see it a lot on the units. And unfortunately, I feel like it does play a big role in how successful our codes are. because if you have someone that's having a PE with a drug overdose, I find
The combination of the two diagnoses is not really conducive.
no, and that's been a common thing that I've come across on the floors that I've worked on.
Okay. So with that not being successful all the time, and we know CPR is not always successful, how do you personally deal with the emotions? And the second question to that is, what about consoling and dealing with either family members or other patients that were in that room when that's happening? Have you had to be part of that?
Yeah, so when I wasn't a part of a code blue, I cried. When you're not a part of it, you just kind of watch everything. But when you are a part of it, you get a peace in your mind that you guys did everything you could for this patient. And that's that. Like everything was done that you could do, and you fought to keep them alive, but they didn't make it. So it kind of settles you and gives you the closure you need when they don't make it and you're a part of that code.
Mhm.
And then the one code that I was running before the code team came, our rooms are so cramped right now in the hospital. It's crazy. I forgot about the other patient on the other side of the curtain. And when the code team comes, there's no time to move another stretcher out, and there's
No,
no room.
no.
There's 30 people in this room, so we pushed him against the wall, closed the curtain,
Yeah, it's like they're
and
getting the best Grey's Anatomy ever in front of their, live TV.
but we got him headphones because it's not a great sound. And someone's getting compressions done is aspirating, and it's a scary thing for someone behind a curtain to listen to.
Yeah.
So we just keep checking up on them and apologize and see if they're okay. And then after the code happened, we sat with the patient and we're like, do you have any questions? First of all, before we tried to talk to them. And they just asked, like, did the patient make it? And we're like, unfortunately, no. And he wanted to look on the other side of the bed, but we said, unfortunately, we want to respect. And we'll be transferring the patient out. So, yeah. And then our manager took over from there, which was nice. And then the family, that was a really hard thing. I think that's the thing I struggled the most with is when you lose a patient and you have to talk to the family, you don't want to cross boundaries or say too much because it's not our spot to, but you also want to be there for them. So I find that's where I struggle is with the families.
Yeah, and being such a new experience, I mean, you're just a year into your hospital nursing. Those things will get easier and you'll find new strategies. But even once you feel comfortable, you'll come across somebody who doesn't respond to your approach.
Yes.
You're struggling all over again. So good for you for having some positive outcomes and experiences with that. I think you've made a good point about when you're involved in it. And so I was kind of resonating with that because as a bedside nurse, I never got emotional about codes. And I could just go back and carry on to the next room like it was nothing else. Of course I was disappointed, but it's a hard thing to
Yeah.
see. But emotionally, I wasn't like crying or anything like that. As an educator, oh my gosh, my students will tell you I cry every time there's a code after it because I feel like I am their mother and I need to protect them from this. And yet at the same time, I am telling them, come in here and do compressions and do the airway with the RT and get involved,
Yeah.
get your hands wet. But when it's all done, I feel like I need to protect their emotional impact. And it's such a hard thing for me as an educator to do that.
Yeah.
I cry more now as a teacher. It's horrible. Oh my goodness. Okay, so where can we go to next? Do you work typically 8s or 12s as a float surgical
I
nurse?
do a mix.
Oh, you do a mix, hey? How do you like that?
I really like it. I love 12 hours, but sometimes when I'm run down, the 8 hours really nice to just peace out at 3 o'clock and be done for the day.
Mm-hmm. Mm-hmm. I really
Yeah.
like the broad experience you have. So it kind of makes me, when I was in the military, we also had to go to many, many units. So burns and plastic, orthopedics, thoracics, general surgery, all that kind of stuff. And I really value all the knowledge that I gained from those units. So I am kind of thinking a float nurse is a really good idea to start with in a lot of ways. So what are some of the downsides to being a float nurse that you find?
I'm glad you asked that. So, the biggest, not struggle, but it's the whole, your schedule's up in the air. You don't know where because you all have your favorite units, any units that you don't like so much. Um, so, like I said, sometimes I get a lot of anxiety when I don't know where I'm going, or they split you 8 hours on a unit and 4 hours on a unit, and it's rough. It's really rough. I think in one shift, they transferred me 6 times because they didn't know where to place me. And so I was 2 hours late starting because they kept moving me. So I was 2 hours behind. So that's one downfall, is you're kind of up in the air. Another one, I find your nursing community, family, you really need that. And as a float, sometimes when you do move around a lot, you don't get to establish those strong relationships with the staff that work on the unit. Mm-hmm. And also sometimes they treat you like the float. So they give you a crappy assignment. They kind of take advantage of it. So that part does suck. And it took me a while, but if you speak up, they'll respect that. But it did take a while for me to speak up.
Your voice?
Yeah, but the biggest thing was feeling like you do have a place just because you're bouncing around so much. But yeah.
Does your float department do any team building activities then to try and build that camaraderie among the float nurses at a minimum, or is it just you show up, you go to work, and you go home?
Pretty much. We do have a staff meeting once a month, but I've not made one yet.
Yeah.
But
Mm-hmm.
yeah. Other than that, like, floats kind of stick together, but we're all fighting, I feel like, for the unit to notice you. And because once a unit really knows you by name, you have an in if you want to pick up a line or a temp position.
So when it comes to those external or internal job postings, then you're a little bit more better positioned to maybe slip into that.
Yeah.
Yeah, and you've had a lot of good insight. That's a really good point, is that you've already gone to a lot of different floors. You know where you want to work and where you don't want to work, whereas somebody who's just coming in for the first time, they have no idea what the culture is like there.
Yeah, and going into an interview as a float nurse, you'd be like, I worked on your unit. And so when they ask you questions, you kind of know the answers to.
Yeah, that's awesome advantage.
Yeah.
All right, so here's, I have a couple more questions, and then we'll do a few Facebook questions. So for those who are listening and are currently in school, or maybe they've graduated, sorry, that's not the question I want to ask. I'm on the wrong page here.
No worries.
Let me go to the other side. So for those who are dabbling, sorry, this is the question I have for you. For those who are dabbling with the idea of working in with patients who are pre-post-op or on a surgical float pool, what are some of the steps you would suggest to them to help prepare them for the job and the tasks?
So they're currently in that position or wanting to?
So they're considering that maybe surgery is a place they want to go explore. So how could they best prepare themselves to take a surgical nursing job?
I would say go back to your books, especially patho. That will be your best friend. That's really, to this day, I still pull out my textbooks and go through my med surge.
I still have my textbooks from a school, and I graduated 2006. All of them. I have all the relevant ones.
Because in your interviews, your panels, it's all scenario-based questions. That's your whole interview. Mm-hmm. And they ask you a lot about skills. And as well, when you do finally get on the floor, you're expected to know how to do these skills. And like I said, it hit me in the face really hard, like terrifying doing a pick dressing in nursing school, we're like, don't even look at a pic. Don't think about it. Don't touch it.
Yeah.
So just really brushing up on your skills and surgical procedures and what to expect post-op.
And not that I want to make a plug for my NurseMinder videos, but I do have some videos on YouTube that go over pick dressings and sterile field and some of those skills. So
I have watched the pick dressing one.
that's awesome. I wanted to make sure people had training on time when they needed it. And I would often get a lot of questions from students. They would text me or they would message me, and I'm like I can't answer at 10 o'clock at night, and I don't have the resource and the capacity to work 12, 24 hours a day. So this was just so much easier for me to answer a ton of questions and just say, hey, have you watched the video? Because that's going to give you everything you need.
That's perfect. As well as when you're actually on the floor, I forgot to mention, we have clinical nurse instructors and educators, sorry. They are your lifesaver, because a lot of the time as a new nurse, you will have to do something that you've never done, that you don't know how to do, and you ask around, no one can help you because everyone else is crashing.
Yeah.
And you can call your clinical nurse educator, and they'll come down to the floor and they'll walk you step by step for anything. If you have a question about a med, if you're concerned about your patients, if you need to do a skill that you've never done. So it's really nice, and always use it.
Absolutely. That's a great point. And of course, if they're not able to come, then you've always got is it Potter and Perry they have on the unit now? I can't remember, but they've got the textbook with all the skills you learned in school. So those are books you never want to sell, people.
So the nice thing too is a lot of units, they laminated any skills that you do on. So wound vacs is on orthopedics and plastic surgery, and it does step by step all of your stuff highlighted. And that's amazing for PICC lines on the unit, and it's all hanging in the med room, and you just grab the booklet you need for the task.
Yeah, it's fantastic. That's good that they've made those quick resources for you.
Yeah.
Okay, my last question is, for those who are struggling to find their fit and maybe their nursing home, which you've kind of found many places you like, what advice can you give them to help them navigate the opportunities in the profession?
So the main thing I want to say is go for anything, because you really don't know what you'll like until you try it. And if you feel like you're not satisfied at the end of the day, keep looking for something. When you get in somewhere, it's just experience that you're gaining. So it's a win-win for you. I think I covered it. Did I cover it?
Great job.
Okay.
I think that's important to take whatever comes your way at first, because it is really challenging right now. When you first started nursing, if you go back to when you entered the school, did you have an idea of what kind of nurse you thought you wanted to be at that time?
So that's funny, actually. So I thought maybe I wanted to go work at the remand, because I went to the police academy. I still found it fascinating working with criminals, but when I went to my preceptor, so in school, I was like, I want nothing to do with maternity, no pediatrics, it's not my jam. And then I had maternity, the course, and I fell in love with it. Wow. And so I wrote a big long letter, and I got into maternity as my postpartum as my preceptor, and I absolutely fell in love with it, and surgery. So yeah, it took me by surprise what I liked and what I thought I liked. And then going in to surgery float, I thought I loved orthopedics until I actually worked orthopedics as a nurse on the floor. I learned that I really hate it, but I still enjoy going there for the experience for wound care, because I really enjoy the wound care.
Plastics is great for wound care too.
Yes.
There's some awesome stuff there.
It's crazy. It's mind-blowing what they do.
Yeah. All right, so a few questions on Facebook. I think we've already answered them though. The first one is, what's the workload like?
Oh my goodness. So it's pretty heavy. Every day I'm running, no matter what unit I'm on. There's obviously some units I'm more comfortable and I kind of got a groove in, but honestly, in surgery alone, as soon as you get on the floor, your call bells are going off. Everyone needs pain meds. the medications are intense. And as well, you need to know when the doctor comes down or asks a question and they point to the nurse, which is you, and you can't answer a basic question. It's really hard to take. So just really know your patients is the biggest thing.
Well, right? It's okay to say, I don't have the answer right now. Let me get back to you.
Yeah.
That's perfect. And
But be organized. So that's the main thing. So my cheat sheets that I use every day, those are the main things I find that doctors come and ask for me, and they expect a nurse to know it just like that. Mm-hmm. So I find having that organization on my clipboard beside me at all times keeps me accountable.
Mm-hmm. Okay, so another question has come in, and it says, have you ever got to go to the OR with your patients?
Yeah, a few times. So ophthalmology, I've gotten to go in, and that was great. Postpartum, I got to go. That was awesome. I got to grab a uterus after a hysterectomy. So that was really cool. And it's crazy how much a human can do. So like a surgeon, it's insane what they can do, and the robots they use to do a surgery, it's mind-blowing. But the main thing I want to stress is, if you go back to when you've ever walked into emergency or a hospital, you're scared, you're confused, you feel out of place. As surgical nurses, I feel like we get very comfortable around surgery, and we have someone that is they have anxiety about their surgery and may just say, you'll be fine. I feel like we do get desensitized to the fact that it's still surgery, it's scary for people. So always keep yourself in check that it's no matter what procedure, going to the OR, getting put under is terrifying.
Yeah. All right, so the last question that's there, and I don't know if we want to tackle this one. This is a big one. Oh. It happens to deal with today's political climate and how the new government has announced this increased scope of practice. I know, I'm like, this could be a whole show in itself.
Yes.
But are you excited about the increased scope of practice?
Okay, so I made a post myself about this. I am very excited to expand my scope. I'm always excited to learn new things and take on new tasks. The only thing that makes me really upset is LPNs are not getting the recognition for how much they do on the floors now. I get a lot of people that say, oh, you're an LPN, can you even give meds? It's like, it blows my mind away. Yeah. Most of the time, we do take the same patient load as RNs, especially in surgery. It's really hard to divide patients equally, and all patient loads are pretty heavy. But I hope that with an increase of scope, we also get recognition in maybe an increase in pay. But now that there's going to be a wage increase, it kind of kills me, and it kind of makes me not want to accept new scopes until we get a pay increase. It's kind of selfish for me, but I work hard and I run, and so to add more to my scope and not really get recognized, as well as have such a huge gap between LPNs and RNs, kind of makes me upset.
Yeah, no, I totally understand that, and a lot of people would share your sentiments for sure about that wage discrepancy, and we are in such a tough political time that it's really not going to help to heal any of those wounds that people will be experiencing as this progresses forward. So let's save the political stuff maybe for another podcast.
Yes, I think so.
Well, I want to thank you for joining us today on Frontline Nursing, Jenny. It's been a pleasure talking with you.
Yes, it was a pleasure. Thank you for having me.
Yeah, so thank you for listening to Frontline Nursing. Join us at NurseMinder.com. Click on the link Frontline Nursing and become a member of our tribe. You'll find access to all the video recordings, and be sure to listen to After the Recording with Jenny as we go over her organizational plans for a variety of different units. And don't forget the downloads.